Hi, my name is Angie Watson. This is my presentation on diabetes. Diabetes is a disorder of carbohydrate metabolism usually occurring in genetically predisposed individuals, characterized by inadequate production or utilization of insulin resulting in excessive amounts of glucose in the bloodstream. When blood sugar is too high, it remains in the blood instead of the cells where it belongs. For the glucose to pass into a cell, insulin must be present and must be hungry for the glucose. Insulin is a hormone needed to convert sugar, starches, and other foods into energy for everyday daily life. Type 1, the body doesn't produce insulin at all. Type 2, blood sugar is controlled by meal planning, weight loss, exercise, and the next step to type 2 diabetes is taking oral medications. Diabetic pills doesn't work on everyone, although their blood sugar levels might go down in normal range. Chances are pills will work if you've developed diabetes recently and need little or no insulin. That way you have 3 therapies on your side: diet, exercise, and oral medications. People with type 1 diabetes, insulin is the only way to keep blood sugar levels down. Type 2 tend to have 2 problems. They don't make quite enough insulin, and the cells of their bodies don't seem to take the glucose as eager as they should. Signs and symptoms of type 1 diabetes is frequent urination, unusual thirst, extreme hunger, extreme fatigue, and irritability. Type 2. Any type 1 signs and symptoms would be a sign of type 2 diabetes. Frequent infections, blurred vision, cuts and bruises slow to heal, tingling and numbness in the feet and hands, recurring skin, gums, and bladder infections. There's some myths about diabetes. Diabetes is not a serious illness. Fact. Diabetes causes more deaths from breast cancer and AIDS combined. 2 out of 3 diabetics die from heart disease or stroke. Myth: eating too much sugar causes diabetes. Fact: no, type 1 is caused by genetics and unknown factors that trigger it. Type 2 is genetics and lifestyle. Overweight increases your risk of type 2 diabetes, and an increased calorie intake, sugar, or fat causes type 2 diabetes. Myth: if you have type 2 diabetes, your doctor says you need to start insulin, it means you are not taking care of yourself. Fact: no. Type 2 diabetes is a progressive disease. Most can use oral medications, but over time the body gradually produces less and less insulin, and eventually oral medications might not be enough to keep blood sugar levels normal. Using insulin to get blood sugar levels to a healthy level is a good thing, not a bad thing. Some complications of diabetes is the foot neuropathy, which is the numbness and tingling in your feet, which leads to non-healing wounds, which usually leads to amputation, which is a cause of gangrene. Damage to kidneys, which leads to dialysis. Damage to eyes, even blindness. A hemoglobin A1C is a test that measures a person's average glucose level over the past 2 or 3 months. Hemoglobin is the red part of the red blood cell that carries oxygen to the cell and sometimes joins the glucose in the bloodstream. This shows the amount of glucose that sticks to the red blood cells. Some prevention tips is a healthy lifestyle, a diet change, exercise, and maintain a healthy weight. Statistics: 25.8 million people have diabetes. Diagnosed 18.8 million. Undiagnosed 7 million. Prediabetes: there's 79 million people that have prediabetes. New cases: 1.9 million 20 years or older was reported in 2010. Today we have learned the 2 types of diabetes: type 1, type 2, and why your body needs insulin to survive. In addition, different ways to maintain a healthy blood sugar, and with proper education, everyone can maintain healthy blood sugar levels. Thank you.